Hi, this is Chris with the Boise Health and Life Insurance Agency. We're here to help you out with health insurance, Medicare, Medicare supplements, Medicare Advantage. Give us a call today. So today we're going to talk a little bit about Medicare Advantage. And Medicare Advantage, you've probably heard in the news, it's pretty big. It's growing a lot. It's another alternative to a traditional Medicare supplement plan. So we've got some frequently asked questions that we're going to go over today. It's confusing. So give us a call. We'll walk you through the whole process. And, it's a big deal when you're trying to figure out which plan you want to go with. Some common questions that you might have, how does Medicare Advantage differ from original Medicare? And a Medicare Advantage plan, it's basically your parts A and B and your D wrapped up into one plan. It's a Medicare Advantage prescription drug plan, MAPD. And they can also provide coverage for supplemental benefits as far as hearing aids, vision care, dental coverage, gym memberships that typically are not offered by original Medicare. So your Medicare Advantage plan covers everything a traditional Medicare does, but it can cover more. Okay, it's up to the company's option. Okay. So is anyone allowed to enroll in a Medicare Advantage plan? Well, it kind of depends. There is open enrollment, an annual enrollment periods. Annual enrollment period, you pretty much can get into any Medicare Advantage plan that's available in your area. Now, there are some things that go on there too. It depends on the plan. In end-stage renal failure, some plans allow that and don't. So you just have to check with your broker, and that's why it's good to work with a broker, is to help you, guide you, and find you the best plan. Okay. What if you have pre-existing conditions? So yes, if you have pre-existing conditions, you can get a Medicare Advantage plan, okay? And if you have severe health issues, there's special needs plans that you can look at, and depending on your income, you may be able to qualify for Medicaid as well, okay? What about traveling with your Medicare Advantage plan? Okay, it depends. Medicare Advantage plans typically are worked through networks, so you can have an HMO or you may have a PPO. And if you do travel, that is a concern, and you want to look at the plans that have great travel coverage. Now, sometimes it's a bigger plan like United Healthcare or Aetna, because they have large networks across the country. So you might look at a PPO that you could actually access out of state. A health maintenance plan, you may not have great coverage out of state. You have to check, but almost all plans, you can always use urgent care in the emergency room, and typically that is covered. So just talk to your agent and walk through that. So if you are if you're enrolled in a Medicare supplement, can you have Medicare Advantage plan? No, you can't have both. You can't have a Medicare supplement and a Medicare Advantage plan. You do have to make a decision upon which one you will be enrolling in or applying for. So let me see here. What's another good one? How do you determine if the plan is right for you? Well, that's a great question. It's insurance. Always remember, with insurance, it's very hard to cover 100% of your risk, typically, because you don't know what that risk is. And if you did know what your risk was or what was going to happen, well, you could probably find a plan that would cover you 100%. But most of us don't. We just don't know what's going to happen. So you do the best you can thinking about your current health thinking about your lifestyle, and then talking over with your broker and using their experience to help guide you as well. So a lot of brokers, like myself, I've been in the business for a long time, so I've had a lot of experience working with people and seeing things that have happened and the results from those things, and that's where we can be a big benefit. So anyways, don't be confused. I've got a nice little report, making Medicare easy. I would love to get that over to you, and then we can sit down and chat about what it is that you're needing to cover in your life. Thanks, folks. Look forward to speaking with you soon.